Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss cardiovascular diseases and its early detection. Hello Dr. Archana, welcome to our podcast for patients, caregivers and healthcare professionals at Medica Talks. Doctor, can you tell us what cardiovascular diseases are?
Cardiovascular disease is a group of disease affecting your heart and blood vessels. These diseases can affect one or many parts of your heart and blood vessels. A person may be symptomatic, that is, physically experiencing the disease, or asymptomatic, that is, not feeling anything at all. Cardiovascular disease includes heart or blood vessel issues, including narrowing of the blood vessels in your heart, other organs, or throughout your body. Heart and blood vessel problems are present at birth. Heart valves that aren't working right. Irregular heart rhythms.
How common is cardiovascular disease?
Cardiovascular disease is the leading cause of death worldwide. Almost half of adults have some form of cardiovascular diseases. It affects people of all ages, sex, ethnicity, and socio-economic levels. 1 in 3 women and people assigned female at birth dies from cardiovascular diseases.
What causes cardiovascular disease?
The cause of cardiovascular disease can vary depending on the specific type. For example, atherosclerosis, plaque buildup in your arteries, causes coronary artery diseases and peripheral artery disease. Coronary artery disease is scarring of your heart muscles, genetic problems, or medication can cause arrhythmias. Aging, infection, and rheumatic disease can cause valve diseases.
What are the risk factors involved in cardiovascular disease?
You may be more likely to develop cardiovascular disease if you have a risk of factors such as high blood pressure, that is hypertension, high cholesterol, that is hyperlipidemia, tobacco use, including vaping, type 2 diabetes, family history of heart diseases, lack of physical activity, having excess weight or obesity, diet high in sodium, sugar and fat, overuse of alcohol, misuse of prescription and recreational drug, preeclampsia or toxemia.
What are the symptoms of cardiovascular diseases?
Symptoms of heart issues may be starting with chest pain, also known as angina. Chest pressure, heaviness or discomfort is sometimes described as a belt around the chest or a weight on the chest. Shortness of breath, that is dyspnea, dizziness or fainting, fatigue or exhaustion. Symptoms of blockage in blood vessels throughout your body. Pain or cramps in your legs when you walk, leg sores that aren't healing, cool or red skin on your leg, swelling in your leg, numbness in your face or limbs. This may be on only one side of your body. Difficulty with talking, seeing or walking.
What are the conditions of cardiovascular disease?
There are many different types of cardiovascular diseases such as arrhythmia, problem with heart's electrical conduction system which can lead to abnormal heart rhythms or heart rates. Valve disease, tightening or leaking in your heart valve. Structures that allow blood to flow from one chamber to another chamber or blood vessels. Coronary artery diseases, problem with your heart's blood vessels such as blockages. Heart failure, Problem with heart pumping, relaxing functions leading to fluid buildup and shortness of breath. Peripheral artery diseases. Issue with the blood vessels of your arms, legs, or abdominal organs, such as narrowing or blockages. Aortic diseases. Problems with the large blood vessels that directs blood from your heart to brain and the rest of your body, such as dilation or aneurysm. Congenital heart diseases. Heart issues that you are born with, which can affect different parts of your heart. Pericardial diseases are problem with the lining of your heart, including pericarditis and pericardial effusion. Cerebrovascular diseases, issue with blood vessels that delivers blood to your brain, such as narrowing or blockage. Deep vein thrombosis, TVT, blockage in your veins, vessels that bring blood back from your brain body to your heart.
How is cardiovascular disease diagnosed?
Your healthcare provider will perform a physical exam and ask questions about your symptoms, personal health, and family health history. They may also order tests to help diagnosis and cardiovascular diseases.
Which test one might have for cardiovascular disease detection?
Some common tests to diagnose cardiovascular disease include blood work, measures substances that indicates cardiovascular health such as cholesterol, blood sugar level, and specific protein. A provider can use a blood test to check for blood clotting issues as well. Ankle brachial index, that is ABI. It compares the blood pressure in your ankle and arms to diagnose the peripheral arteries. Electrocardiogram, that is EKG, records your heart's electrical activity. Ambulatory monitoring uses wearable devices that track your heart rhythms and rate. Echocardiogram uses sound waves to create an image of your heartbeat and blood flow. Ultrasound can be used sound waves to check the blood flow in your legs or neck. Cardiac computerized tomography, that is CT. It uses X-ray and computer processing to create a 3D image of your heart and blood vessels. Cardiac magnetic resonance imaging, that is MRI. It uses magnets and radio wave to create a highly detailed image of your heart. MR angiogram or CT angiogram is used as an MRI or CT, respectively, to see the blood vessels in your head, neck, and legs. Stress test analyzes how physical activity affects your heart in a controlled setting, using exercise or medication to determine how your heart responds. This type of test can involve EKGs or imaging test. Cardiac catheterization uses a catheter, which is thin hollow tube, to measure pressure and blood flow in your heart.
How are cardiovascular diseases treated?
Treatment plans can vary depending on your symptoms and the type of cardiovascular disease you have. Cardiovascular disease treatment may include lifestyle changes, for example, include changing of your diet, increasing your aerobic activity, and quitting smoking or tobacco products, including vaping. Medication. Your healthcare provider may prescribe medication to control cardiovascular diseases. Medication type will depend on what kind of a cardiovascular disease you have. Procedures or surgeries. If medication aren't enough, your healthcare provider may use certain procedures or surgeries to treat your cardiovascular diseases. For example, include of a stent in your heart or leg arteries, minimal invasive heart surgery, open heart surgery, ablation or cardioversion. Cardiac rehabilitation. You may need a monitored exercise program to help your heart get stronger. Active surveillance. You may need careful monitoring over time without medications or procedures.
How can I prevent cardiovascular disease?
You can't prevent some types of cardiovascular diseases such as congenital heart disease, but lifestyle change can reduce your risk of many types of cardiovascular diseases. You can reduce your cardiovascular risk by avoiding all tobacco products, managing other health conditions such as type 2 diabetes, high cholesterol, or high blood pressure, achieving and maintaining a healthy weight, eating a diet low in saturated fat and sodium, exercising at least 30 to 60 minutes per day on most days, reducing and managing stress.
What is the outlook for people with cardiovascular disease?
Many people enjoy a high quality of life and can manage their cardiovascular diseases with the help of their healthcare team. Your chances for a positive outcome are higher if you engage in your healthcare and follow your provider's treatment plan. It is important to take medications exactly as prescribed.
Does cardiovascular disease increase the intake of other conditions?
Untreated cardiovascular diseases can lead to serious complications such as if you have cardiovascular disease, you may have a higher risk of heart attack, stroke, acute limb ischemia, that is sudden blockage in your leg arteries, aortic dissection, sudden cardiac death.
When should one see healthcare providers and what message would you like to give to the society?
Cardiovascular disease is often easier to treat when healthcare providers catch it early. That's why it is important to see primary care provider every year. They can detect cardiovascular issue before the symptoms start. If you have a sign of cardiovascular disease, you should see your provider immediately. Seek emergency medical attention if you experience sudden chest pain, pressure, heaviness, or discomfort, especially with exertion, fainting, severe shortness of breath, especially if it is new or progressive, pain or numbness in your arms and legs, ripping or tearing back pain. Cardiovascular diseases are the condition that affects your heart and blood vessels. Without appropriate treatment, heart diseases can lead to heart attack or stroke. You can make your lifestyle change or take medications to manage cardiovascular diseases. Early diagnosis can help with effective treatment. Many people live a full and active life with cardiovascular disease.
Thank you, doctor, for being a part of Medika Talks and sharing your insights. I hope the insights that you have shared with us will be valuable to our listeners.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.